One of the issues that had been identified was to have healthier choices in restaurants, and so the Healthy Choice Restaurant project grew out of that. The project engaged businesses within the community as well as agencies within the community to help to promote the project. So we had to identify what it was we wanted to do. We had to identify what resources would be needed to facilitate success for the project. We had to figure out who the stakeholders had to be, and we had to establish what sort of controls we would have for the project. We asked the media to help us to promote healthy eating, active living. Some of this was done through public service announcements. Some of it was done through paid advertising, where the radios were paid to promote these healthy eating messages initially, and then to promote the restaurants that were participating in the program, in the project. We also engaged the local newspaper to run newspaper articles over a period, regular newspaper articles over a period of time that would convince the community, or that would provide the community with food for thought on possibly changing eating habits and choosing healthier choices when eating in restaurants. The challenge that was presented by the participating restaurants was that they felt that the community wouldn't be willing to, or would not be receptive to changes on the restaurant menu that offered healthier eating options. They felt that people were very willing to eat the foods that were offered, even though the restaurants did think that they were not always the healthy choices, and that they were willing to make the changes, but they were afraid that the community wouldn't buy into those changes. At the end of the project, there was awareness of the Healthy Choice program in the community, and it was fairly well received. Restaurants didn't feel that it was a waste of their time or to continue with the project, and that the healthy choices were being requested. So sustainability of the project pretty much depends on demand from the community at this point.